And the next speaker will be continue on what is the comprehensive care or integrated care. So we move to the topics on mental health and stigma and discrimination. So I would like to introduce Dr. Sateesh Ganguli. He's GP from UK working at NHS Trust, and he spent 1 year with us as a fellow at Chulalongkorn University. So he will share with us about his project and his focus on mental health and stigma discrimination. So we are proud of you, Sateesh. Go.
Thank you so much for the kind introduction. It's a real pleasure to be given this opportunity to be able to talk with you all today. Before I start, I'd just like to give another plug to the Buddy CU youth group, who have very kindly provided all of the artwork that you'll see in this presentation. And if you'd like to see it in the flesh, I'd encourage you all to visit the booth just outside. So today I'm going to be talking about self-disclosure in young people with behaviorally acquired HIV infection. So disclosure is the process of revealing one's HIV status. And I think often, particularly when it comes to a pediatric or an adolescent population, we often think about disclosure as telling a child, often with perinatally acquired infection, about their HIV diagnosis. But that's slightly different to what we're talking about today. So today is around self-disclosure, so revealing one's own HIV status to other people within the population of 15 to 24-year-olds, adolescents and young adults with behaviorally acquired infection. So in the next sort of 15, 20 minutes, I'm going to try and go some way to answering these questions. So we're going to talk a little bit about what we understand around self-disclosure of HIV status amongst young people living with HIV. And then I would encourage or invite you all to think collectively what we can do to support young people wanting to disclose their HIV status to others. I'm going to start, if I may, with sharing a personal story, which I hope has some relevance to the topic that we'll be talking about today. So when I was 18 years old, my mother passed away. And this is actually a photograph of a memorial to her in a village in India where she worked for many years. And in many ways, I was fortunate. I had a very close family, good friendship group, and a good support network. But for some reason, I found talking about that process at that age incredibly difficult. And it was only until several years later, I think, where I started to become more comfortable with talking about it. And actually, when I started to talk and share my experience, I found that very therapeutic. And I felt that I got a lot of support from doing that. Now, clearly, a bereavement is not the same as an HIV diagnosis. So there's no stigma attached, there's no discrimination. I didn't feel personally responsible or my actions were to blame. But I think that there are some parallels that we can draw, that particularly at that young age, it can be very difficult to talk about personal experiences. And it's not always that I didn't want to talk about those things. I think sometimes at that age, we don't necessarily have the skills or the tools or the words to talk about it. And I think often if we can help to support people in this process, it can make that a little bit easier for them. So I would like to start with conducting a thought experiment, if I can. So I want you all please to imagine that you are walking alongside an 18-year-old living with behaviorally acquired HIV. And they are considering disclosing their HIV status to somebody close to them, whether that's their friend, their partner, their family member. And I want to give you a few moments just to think about what kind of word or words you think may describe what they're thinking about in that moment, or what's going through their mind. How do they feel? How do they think? I'll give you a few moments. So we asked that question to 85 young people, aged between 15 and 24 years old, living with behaviorally acquired infection. And we'll talk a little bit more about the study in a moment, but I just wanted to have that slide here to give us some context when we're framing about what it is like to go through this process. And it's color-coded so that the green words tend to be more positive or more neutral responses, and the red words tend to be more negative responses. And I think the message in this slide really is that disclosure is a very complex and very personal decision. And it's going to mean different things to different people. And I think we have to be very sensitive and aware of that fact when we're approaching these conversations, and we have to do it in a very individual-led manner. Okay. So self-disclosure. So self-disclosure is, as I said, the process of revealing one's HIV status to another person. And much of the evidence that we have around disclosure relates to disclosing to children of perinatally acquired HIV, or of the self-disclosure amongst adult populations. And there's very few studies that looked at the self-disclosure of young people with behaviorally acquired HIV infection. And those studies that do look at self-disclosure tend to be in the adult population, and they show that there's a huge variety in rates and patterns depending on different populations or different countries that are being studied. The WHO in 2014 published some guidelines that recommended that adolescents should be counseled about the benefits and the negatives of disclosing their HIV status to other people, and that they should be supported and empowered to decide if, when, and who to disclose to. And I think often when we think about self-disclosure, we think about the benefits. So the increased access to social support services, improved engagement to care, treatment adherence, and an uptake in HIV testing. But I think we also have to bear in mind or be aware that there can be negative consequences of disclosure. And those can include discrimination, breakdown in relationships, rejection, and even violence in some cases. I also want to highlight that the guidelines that this recommendation came with last published in 2014, which is 10 years ago, and they haven't been updated. So I think that it does show or highlight that there is a need for more research in this area, for up-to-date evidence and research. And this leads me to talk about the study that we recently conducted, and I want to thank all of the study team that were involved in the study. We wanted to understand about the rate and the pattern of HIV self-disclosure within our population of adolescents and young adults with behaviorally acquired HIV infection, to understand about some of the factors that may be associated with their self-disclosure, and importantly, to try to listen to their experiences and explore their perspectives on their self-disclosure journey. So we designed and conducted a single-center cross-sectional analytical study, and it was conducted at the Buddy CU clinic just down the road from here, which is a youth-friendly service that provides HIV treatment and prevention services, as well as other services. We designed a mixed method study, so we used semi-structured interviews, screening tools, questionnaires, and existing service user data. And the inclusion criteria was for individuals to be between 15 to 24 years old and living with behaviorally acquired HIV infection. And we managed to recruit 85 participants, which is almost all of the participants attending our clinic that met the inclusion criteria. And that included 3/4 of those who were adolescents at the time of their HIV diagnosis. The majority men who had sex with men, but there were also 8% transgender women and females as well. 2 in 5 of our population lived with their family. 1 in 5 lived alone or with friends or with a partner. And this shows the disclosure rate amongst our population. So we found out that 84% of the participants that we've spoken to had disclosed their HIV status to at least one other person. And I think in isolation, that's a fairly encouraging or impressive statistic, and it certainly compares favorably with other studies that have been done. But it still leaves 1 in 6 of our participants who had never disclosed their HIV status to anybody. And when we break it down into disclosures to certain key relationships, we find that 3/4 of them had disclosed to a partner, just half had disclosed to any of their friends, and half to their mother, and 1/4 to their wider family, including their father, and fewer still to colleagues and teachers as well. We asked them about when they made their disclosures, and we realized that for those individuals who had disclosed to family members, the majority of those disclosures come quite soon after their HIV diagnosis, within the first month. And it takes often or generally slightly longer for those disclosures to be made to partners and to friends, but the majority of those, again, were made within 6 months. We asked about their frequency, so how often are they making new disclosures to new people? And just 1 in 10 of the individuals that we spoke to had disclosed their HIV status to somebody new within the last 3 months. We wanted to find out why they made their disclosures to certain relationships. And the way that we categorized the reasons that they gave were into relationship ties, so about strengthening existing relationship bonds, for the requirement of practical or emotional support, maybe they needed a lift to the doctors, to explain a change in either appearance or behavior, so maybe to explain why they were going to the doctors, and for HIV prevention or promotion reasons. And you can see that for disclosing to their family, friends, or to their partner, the most common reason given was to strengthen those relationship ties, and that was followed with practical or emotional support. And explaining a change in appearance or behavior was quite infrequently given as a reason to disclose. When disclosing to partners, HIV prevention was given as a reason around 50% of the time. And that's perhaps not unsurprising. But I think it's also worth noting that even when disclosing to partners, it was still more important to strengthen those relationship ties and for the practical and emotional support. We asked them about their attitudes and their experiences in self-disclosure. So we asked them a series of statements, some of them which I've included in this slide, and asked them whether they agreed or disagreed. So the green bar represents those agreeing with the statement and the red bar with disagreeing. And less than 1 in 5 reported that they had found it easy to disclose their HIV status to somebody else. But when they had made those disclosures, over 80% of those reported that it had improved their mental health and it had been overall a positive experience, and less than 1 in 10 disagreed with those statements. So, as I say, we conducted interviews with all of our participants, and as we were analysing the interview transcripts, we were trying to identify different factors that were suggested for reasons why they'd made their disclosures. And it was helpful to categorize them into individual factors, factors relating to the individual themselves, recipient factors, interpersonal relationship factors, and societal factors. And the factors relating to the individual that came up over and over again was around their readiness to disclose and the necessity of that disclosure to that person. They talked frequently with regards to the recipient about having to ensure that they would be accepting of their HIV diagnosis, and that often was linked with the recipient's knowledge of HIV infection as well. Trust was a big factor in their decision to disclose to certain people, and as was intimacy or the closeness of their relationship with that person. And wider societal factors like stigma and the intersectionality with LGBT issues was also a factor behind their decisions whether to disclose or not. So I'll just talk about some of the positive outcomes, and they were not limited to those that I picked on the slide. But some of the positive outcomes of disclosing for the young people that we spoke to included improved practical support, for example, helping with reimbursement for medication costs, helping with treatment adherence, so setting reminders or reminding individuals to take their medication, and HIV prevention encouraging as well. Okay. But it's also worth noting as well that for some of the individuals that we spoke to, disclosing had negative consequences and negative outcomes. Often people experience discrimination after disclosing their HIV status, and that could be at work or also at home as well. And often they described breakdowns in relationships as well, again with family members, but also romantic relationships as well. So thank you very much for your attention. I'd just like to conclude with some take-home messages. I think the first message really is that HIV self-disclosure is a very complex and personal decision, and it's going to be different for different people and at different times. And I think we have to be very sensitive when we're approaching these conversations. Self-disclosure is very challenging. as I know, disclosing something personal and important at that age can be very challenging. And then you throw in all of the societal pressures and the stigma that comes with the diagnosis. It can be very difficult, and I think we have to be aware of some of the negative consequences of disclosure. But of the individuals that we spoke to, they consistently had positive outcomes after their disclosure. And I think also as people that want to try to help to improve the lives of people living with HIV, I think we all have a role that we can try to make this process easier for people. I think as clinicians, I would encourage you to open the conversation, start talking to your patients about this. And as researchers, I think that there's a big gap that there's lots more we need to learn on this topic. So I'd encourage you to study this area. Okay. Just like to thank everyone, the participants in our study, the Buddy CU youth group, and especially the study team for all the help. And thank you.